Hello and welcome to our Psych Congress Video Roundtable. We'll be talking about hot issues in schizophrenia. Joining me today are Doctors John Kane and Jonathan Meyer. Welcome.
Thanks very much.
Thanks for having me, Les. Really appreciate it.
Let's talk about new antipsychotic agents. Like, what is TAR1? What is it and what place do they have in treatment? How do their adverse event profiles differ from what we already have? John?
Yeah, it's very exciting to have some new compounds that don't rely on dopamine receptor antagonism. What we've seen with the drugs that we have available up until now is that they all share that common mechanism to varying degrees. But those medicines are also associated with a variety of side effects, extrapyramidal side effects, weight gain in some cases, prolactin elevation in some cases. We also see that about 30% of patients really don't derive significant benefit from the medicines that we have. So having alternatives with different mechanisms of action is very exciting. I think the TAR1 agonism is a very interesting phenomenon because peripherally it reduces appetite and body weight and improves insulin sensitivity, and centrally it can reduce the uptake of dopamine into presynaptic terminals. And so that's a way of reducing presynaptic dopamine levels. So in effect, we can exert an antipsychotic effect without the direct dopamine receptor antagonism. And the work that has been done with the first TAR1 data to be published, I think is very exciting because it showed significant effects, an effect size of 0.45 on the PANSS total in a population of schizophrenia patients who were acutely ill, ages between 18 and 40, with an acute onset within the last couple of months. They were treated for 4 weeks. So the results were quite encouraging. And in terms of the adverse effect profile, somnolence was the most common adverse effect, about 6 or 7% in comparison to placebo, which was about 5%. Other side effects, there were no EPS or metabolic effects, so that's very encouraging. And I think this looks like a promising compound. The first report of the acute study was published in the New England Journal of Medicine, and I think we're very excited about having this as a potential option down the road.
Thanks, John. You know, there's another paper in the New England Journal of Medicine about yet another novel mechanism, and that of the muscarinic modulation. You want to tell us a few things about that?
Sure. Well, so xanomeline is a muscarinic M1 and M4 receptor agonist that has some effect on M5 as well. And we had reason to believe that xanomeline would be an effective antipsychotic because there's a very important balance between dopamine and acetylcholine in key brain areas that appear to be related to schizophrenia. But the challenge was the peripheral side effects of this kind of agent. So what was done was combining it with trospium, which is a peripheral agent that reduces the adverse effects by about 50%. So this, as you said, these data were also reported in the New England Journal of Medicine, a study that involved a little under 200 patients who were followed for 5 weeks and showed very good effects on the PANSS, positive and negative, and also well tolerated. The main side effect was constipation, and some nausea and some dry mouth, but relatively few patients were, discontinued. I think the overall results in terms of tolerability were quite good, and superiority over placebo was quite impressive. So I think here too another mechanism of action that is distinct from what we've been accustomed to, and the ability to reduce the adverse effects associated with these compounds is, I think, is very promising.
Well, thanks so much. Jonathan, anything else to add about can we treat psychosis without blocking D2 receptors?
Well, we've had evidence from the Parkinson's disease world from a drug pimavanserin, which really is a very selective serotonin 2A inverse agonist, but with some affinity for serotonin 2C. It works for Parkinson's disease psychosis. It has nothing to do with D2. It shows antipsychotic activity. Now, again, that's not schizophrenia, but I think it did really give us the sense that maybe we can modulate this system without directly doing anything at the D2 receptor. And now these two new mechanisms are very exciting. And as Dr. Kane said, positive phase 2 data moving into phase 3.
Terrific.